Welcome to today's MESTD Learning Community Echo, Adolescent Medicine, How SUD Fits. Today we'll be hearing from Terry Bravender on how to make adolescent and young adult friendly. I'm Bethany with CCSME and I'll be supporting today's webinar. Just a few quick notes before we begin. First, neither the presenters nor the planners have any relevant financial relationships to disclose. This activity has been planned and implemented in accordance with accreditation requirements and policies of the ACCME through a joint providership of the Hanley Center for Health Leadership and Education and CCSME. The Hanley Center is accredited by the MMA Committee on Continuing Medical Education and Accreditation to provide CME for physicians. The Hanley Center has designated this activity for one AMA PRA Category 1 credit. Recording and live stream transmission of this webinar without consent is not permitted. And now I'd like to hand it off to Dr. Robbins to introduce our speaker for today.
Okay, well, hi everyone. I wanted to introduce, I'm pleased to introduce Terry Bravender. He holds a MD and MPH degree. He is the David S. Rosen Professor of Adolescent Medicine at the University of Michigan in Ann Arbor, Michigan, where he also holds an appointment as Professor of Psychiatry. He is the co-medical director of the University of Michigan Adolescent Health Initiative, executive director of the Comprehensive Eating Disorders Program, and associate chair for faculty affairs in the Department of Pediatrics. Dr. Bravender is a graduate of the University of Michigan and Harvard University and previously held faculty appointments at Harvard, Duke, and Ohio State. He has published more than 100 articles, book chapters, and books in the field of adolescent health, eating disorders, and patient-centered communication. He also serves on the editorial board of the Journal of Pediatrics and Eating and Weight Disorders. Dr. Bravender is active in the Society for Adolescent Health and Medicine, the Society for Pediatric Research, and the American Board of Pediatrics. So welcome.
All right, thank you, Dr. Robbins, and greetings from Ann Arbor to everybody there in Maine. All right, so we're going to talk this morning about what makes your practice youth friendly. So as I think we all know, adolescents and young adults are the physically healthiest of any age cohort. As we also know, they have high rates of preventable health problems. And even though we're not this is not the focus of the discussion, I think it's just a quick reminder to look at a lot of what teens are dealing with should be considered preventable health problems. And these are the most recent data available. And I will tell you, trying to track down data for this talk was a little bit of a challenge, but the top three causes of death in ages 15 to 19 are unintentional injuries, homicide, and suicide. And then you can see there's a big drop off in terms of the rate per 100,000 youth when we get to the next causes: cancer, heart disease, congenital anomalies, etc. And we like to think that unintentional injuries, homicide, and suicide are preventable. And then if we look closer at those unintentional injuries here, you can see that the majority of unintentional injuries, this is not surprising, are caused by motor vehicle crashes. There's also unintentional poisonings, drownings, and other unintentional deaths, including unintentional discharge of firearms. And speaking of firearms, in there was suicide and homicide. This is a report from New England Journal of Medicine from a couple of years ago, looking at just differentiating causes of mortality in youth a little bit different way, looking specifically at motor vehicle crashes there on the top in blue. And then in the past few years, firearm-related deaths have overtaken motor vehicle crashes as the number one cause of youth mortality. There are other things other than death that we worry about, and this is the substance use disorder seminar series, so I'm not going to belabor this point, but you can see this graph shows any illicit drug use ever by 12th graders, data from the Monitoring the Future study here at University of Michigan. The bottom line is blue, any illicit drug other than marijuana, and even in the current legalization state, I guess for historical purposes, I keep marijuana on the illicit drug use category. But you can see, even though rates have fallen since their peak in the late 1970s, it obviously still persists and is a problem. Other health risks include relatively high rates of STIs in youth, including chlamydia, having the highest rates in ages 20 to 24 in our young adult population. Those rates have been persistently elevated despite the fact that fewer teenagers have actually been having sex. And this just shows data from the CDC in the percent of high school students who've ever had sexual intercourse over time, starting back there in 1999, ending with the last data available, which was 2021. Top 12th grade, 11th grade, 10th grade, and freshmen. And as you can see, rates had been steady for a while and then slowly falling, and then a drop off in really around the pandemic that seems to have probably persisted. We worry also not only about STIs, but unintended pregnancies in youth, of course. And fortunately, as I think everybody is aware, the birth rate in teens has been falling pretty dramatically for the past 20 or 30 years, as has the abortion rate. So this is really about pregnancy prevention, either through increased rates of abstinence and through increased contraceptive use in teens. So teens are doing something well here. And I just thought I'd throw in the pregnancy rate here in Maine compared to the rest of the country, which is far below the average for the country and most of the other states. Now, that all sounds good about fewer teens are having sex, fewer teens are doing drugs, fewer teens are getting pregnant. And that is good because it's preventing the health outcomes. And whether this is related to increased rates of anxiety and depression in teens or not is a debate for sociologists. And I think some of the kind of omnipotence and omniscience that teens traditionally have had allows them to take do a lot of risky behaviors in order to kind of position themselves well in society and be safe taking risks until they realize what those risks really mean. If they don't take those risks, there probably is a higher chance of developing more severe anxiety disorders, which I'm sure everybody has seen in their practices, and that's borne out here in the data. All right, but that's not what I'm here to talk about. I'm really here to talk about not what are the risks and what are bad things going on with teens, but how do we make our practices more youth friendly, and what do teens worry about? So I think one of the key pieces that you're going to hear in this it has to do with my work with the University of Michigan Adolescent Health Initiative, and one of our cornerstones of our group is really listening to the voice of youth. And this is a survey from Pew Research Center. It's percent of teenagers saying that each of these topics is either extremely or very common, somewhat common, or not too common at all among teens who go to their school. So you can see that anxiety and depression tends to be the most common that they perceive other students are dealing with. Bullying is up there. Drug use is a little bit further down. Physical fights are further down, and alcohol use is still present, certainly, but not as prominent as anxiety and depression. This is from the same survey asking teens, really, what do they feel peer pressure to do, or not just peer pressure, but I guess pressure in general to do. And by far, number one is get good grades. These are divided up by gender. The kind of difficult to see, I guess, off-white bar is both genders together. Orange are girls, green is boys. So everybody feels some pressure to get good grades. Looking good, girls are a bit higher than boys, but still up there. To fit in socially, be physically strong, be involved in extracurricular activities, be good at sports, and a really small number say they feel pressure to be sexually active. And if we look back at this, I think these are all very, for the most part, pro-social things that you'd expect from teens, right? We want our teens to get good grades. Teens want to fit in socially. They're not physically strong, but physically active is good and do good things. I'm glad to see that they're not feeling as much pressure to be sexually active. Now, if you ask their parents, what are they worried about happening to their children at some point? Again, number one from parents is they're worried that their teens will struggle with anxiety or depression, probably because many of them are. Uh, they're worried about their kids being bullied. This one, parents have high worries about being kidnapped or abducted, which I think, as we know, is pretty unlikely to happen. But parents still do worry about it. Getting beaten up or attacked probably is related to fears of being bullied. Problems with drug or alcohol, getting shot is still pretty significant. And getting pregnant or getting someone else pregnant, parents worry about, and then getting in trouble with the police. All kind of high bad outcome, relatively low probability these days, but still an issue. Now, how does this translate to medical practice? Well, many parents think that doctors should be talking about most of these topics with their teenagers. And when parents are surveyed, asking which of these topics is very important for physicians to discuss with their children, the majority of parents, at least for the older adolescents, think that doctors should be talking about the physical changes of puberty, sexually transmitted diseases, pregnancy prevention, especially with the older teens, and pregnancy prevention in general, as well as emphasizing abstinence. I think it's important for physicians to be discussing drug use, tobacco use, drinking, as well as depression and suicide. Interestingly, I thought, even though parents seem to be worried about bullying at the schools, they really don't see that as something for doctors to get involved with. All right. So how do we apply that into the office-based setting? Because that's really what we're here to talk about. Well, one of the cornerstones of taking care of adolescents really is confidentiality. And I think, as everybody knows, American Academy of Pediatrics and the American Medical Association recommend seeing patients alone for part of the annual visit, starting pretty young. They say even as young as 11, maybe 12 years old, and certainly by 13, a portion of it. And as adolescents get older, more time should be spent independently with the provider. Now, why is confidentiality important? I think everybody has a rough idea about it. And it's not, I mean, one of the things I always emphasize with my trainees is it's not about keeping secrets from the parents. And we'll get into this a little bit later, but I think it's really important to help youth move from the stance of helping them move from don't tell my mom to how can we best involve your mom? Now, we know that explicit assurances of confidentiality have been shown to increase teens' willingness to disclose sensitive information, like topics about sexuality or substance abuse or their own mental health issues. And if you survey parents, most parents who understand the rationale for confidentiality, they understand it gives teens an opportunity to share uncomfortable topics and that doctors will involve parents as needed. They then really are supportive of confidential time with their teenagers. There's a very good policy statement from the American Academy of Pediatrics last year, written by my former colleague at Duke, Richard Chung, who actually is now at CHOP. But the policy statement really lays out some important steps for providing confidentiality and a good backbone for this. So when providing confidential care, it really involves respecting the adolescent's request for confidentiality. Sometimes we're legally required to, sometimes it's permitted, but we need to respect that when the teen asks for it, if we're able to. Always, we need to prioritize the health and well-being of the adolescent, and really understanding that doing so may necessitate breaking confidentiality. And I think we probably all had that experience of a teen who discloses acute suicidality, or a teen discloses really severe substance use disorder. If I find out a 15-year-old has been, I don't know, tried fentanyl or heroin with an older friend or his older sibling, which was literally a case of mine, I involved his father without his permission. we really want to encourage the minor adolescent to share important information with their parents. And it's that moving from don't tell my mom to how can we involve your mom. We want to support teens and their parents to understand kind of normative changes in autonomy that time alone with the provider will help facilitate. And the point of spending time alone with the doctor is to help teens move to independence. And whenever I've told a parent that for themselves, parents are all about that. They always want their teen to be more responsible. We want to really promote alignment with parents centered on the well-being of the adolescents. So everything we do is the center on youth well-being. And we also need to be aware that marginalized groups may have high levels of medical mistrust, and because of that, they may have heightened concerns for confidentiality, and it may take more time to develop that relationship. And then, of course, all of this has to be done in the context of federal and state laws that may vary depending on the time. Right? So, in the context of that, the developmental nature of this. So this is a handout from our Adolescent Health Initiative that many of our practice really just different tasks for developing. You should learn about your medical history and know about medications if you have to take them when you're really young. And then when you're 13 or 14, you really should be spending time alone with your healthcare provider. And if you don't, you should feel empowered to ask. When you're getting a little bit older, 16-year-olds should be able to start making their own appointments, especially if they've got an app on their phone to be able to do it. They should be able to get refills of their medications. And then when you're 17 or 18, you should really be able to access healthcare on your own without a parent involved. All right. Those resources are all available on our Adolescent Health Initiative website. And we have handouts available for state-specific confidentiality for 21 states. Unfortunately, Maine is not included. But after this, I'm going to ask our staff to get on that since I'm giving this talk to you guys. All right. And just as an example, it's a one-page handout that providers can use, adolescents can look at, and this is one specifically for the state of Michigan. We make sure to keep them just one page and hit the highlights on what is allowed, what is expected, and what may not be allowed. All right. So that's a lot of kind of my talk about what's important about confidentiality, why it's important. And I thought for the next pieces of it, since we're going to talk about what clinics should look like and what we should do with staff, I thought I would play a video that was made by some of our youth through the Adolescent Health Initiative. So we're going to go right here.
Hi, I'm Julie.
I'm Brandon.
Clara.
And I'm Felipe.
We're here to talk about some ways that health centers can meet the needs of teens and young adults through things like physical space, policies, and personal interactions.
There are tons of ways to help teens feel welcome. Here are some of our ideas.
For some of us, getting to appointments can be challenging.
Having bike racks outside can make it easier for when we don't have transportation.
Posting hours outside your clinic is important, and make sure you have times after school hours so students can get there too.
It can really help some of us with unpredictable schedules if you accept walk-ins.
And if we happen to run late for an appointment, please try not to make us feel like we've broken the law.
The more comfortable we feel, the more we'll want to come back, which will help us get better health care.
Your waiting room matters. It's our first impression and a place where your teen patients will have to, well, wait. But hopefully not too long.
And waiting means sitting, so why not have comfortable options for all shapes, sizes, and ages?
I know doctors' offices are for little kids, but they're for teens too.
Why not show a diversity of styles and types of artwork?
And maybe even feature some pieces by local teen artists.
I'd like that.
Real plants are great too, but if they don't look taken care of, it makes me feel like I might not be either.
Magazines are standard in any waiting room, but why not have some that are geared to teens, like 17 or Electronic Gaming Monthly?
No, I want Mad Magazine or J14. Or Wi-Fi. I'd like the Wi-Fi password posted even better.
Hey, what about magazines in other languages? Y servicios de traducción en otros idiomas sería aún mejor.
Yeah, also show that the space is safe and inclusive of LGBTQ plus youth, such as a rainbow sticker on the door.
Teens can have pretty different interests, but one thing that matters to all of us is privacy.
Definitely. Having some kind of dividers at the reception counter can help keep us comfortable when we share private information.
I've even been at a place that had a white noise machine to make it hard to overhear.
As much as we love the reception area, we're really here to get into the exam room.
Of course we expect it to be clean and professional, so what matters most is our interaction with our doctor.
This means we're getting good eye contact, non-judgmental listening, and welcoming body language.
Having a confidentiality policy clearly posted in the room really helps us feel comfortable being honest.
And so is doing check-ins throughout our appointment to make sure we're on the same page.
Remember, not all situations are the same, and not all teens are the same. When in doubt, ask us.
All right. So I think I love that video so much. And I think building on that, and all of those suggestions were created by our Youth Advisory Council, and with some assistance from our staff, they wrote the script and produced all of that. And based on that work, the teens also wanted to be able to create a group of places that were youth friendly, and where if a teen is new to the area and wants to find a good practice to go to, what would be a good place for them. And they wanted to do these assessments themselves. And so our staff worked with them to create a community resource guide and a checklist that they could go through when looking at various doctors' offices, mostly of their own, and then share them with their friends on the advisory council. And so they had a one-page checklist. They were just right here, the contact information. They'd write down the organization's name, telephone number, website, address where they're located, and the services they were interested in. They asked people at the groups, did they have food assistance or pantries, mental health services, health insurance enrollment assistance, nutrition, housing or shelter information, primary health care, which was the main piece that they were looking for. Were there services for intimate partner violence, sexual reproductive health care, immigration support, tutoring, job training, legal services, and then any other specific items that the practice or youth center might offer. And then specific characteristics that they were looking at. Does the clinic provide, obviously, service to adolescents? Do they have hours that are accessible to youth, like after school, evening, or weekend hours? Is it in a location that's accessible, like near a school, or accessible by public transportation? And do they have translation services, or their providers who have languages that are spoken by youth in the area? In our area here in southeastern Michigan, that might include Arabic, Japanese, and Spanish. Will they see youth without parental consent? Do they offer confidential services? And do they have a sliding scale or any program for people with minimal insurance or no insurance? And then for the specific health services, does the clinic also provide multiple birth control options, long-acting reversible contraceptions like IUDs and Nexplanon? Do they have free condoms, access to emergency contraception, testing for STIs, pregnancy testing, and mental health counseling? And they go down that checklist, and then teens could write in whatever they wanted, if there were other good things or things they didn't particularly care for, and then check off. And then they would have a discussion amongst the Youth Advisory Council whether this place should be listed on their teen-friendly resource guide. So the teens did that, and we used that to create a really a consultation endeavor that the Adolescent Health Initiative runs, called the Adolescent Centered Environment Assessment Process. And these, again, are based on input from the teens, their assessment of various locations around southeastern Michigan. And if groups participate, they can earn gold, silver, or bronze certificates if they're able to, over the course of a year, meet 11 of the certification requirements, and then, a little bit lower for silver or bronze. And there are some things that some groups simply can't do. And we'll get to the one that seems to be the biggest holdup when we go through these 11 steps of creating an adolescent-centered environment. Number one is make sure you have extended hours for adolescents, including some evenings and or weekends. And that seems pretty obvious, I think, to most primary care groups. I have had a hard time spinning this on our specialist providers here at Mott Children's Hospital, but it's incredibly important for teens that they don't have to miss school every time they come into the doctor. There should be lots of visual cues throughout the waiting area or exam room, or materials that they provide at check-in to indicate that adolescents are welcome and valued population. And it can feel like that if you're in an internal medicine office or even a family medicine office. The teen might be by far the youngest person there, or if they're in a pediatrics office, they might be by far the oldest person. So like in our video, if there are not just little kid art on the walls, but something maybe even made by teens would be great. The staff and providers should have received training on confidentiality for minor patients, including state law regarding minors' ability to consent for specific services, and the staff needs to know when caregiver notification is mandated. Adolescent confidentiality and minor consent rights should be displayed in the waiting room and or exam rooms, or specifically given to patients at every visit. Most groups that we work with put these in the exam rooms. All providers should have a standardized process of having adolescents confidentially complete a comprehensive risk screening tool for high-risk behaviors, and they should do that at least yearly. And there should be workflows in place to ensure that providers and staff review immunization records. And that seems pretty basic, but the key is that we need to offer recommended immunizations at every visit, including walk-ins or same-day appointments. We should offer STI screening to all sexually active adolescents and follow those national guidelines. There should be a system in place to provide same-day LARC, that's like Nexplanon or IUD placement, if requested. And this is the one piece I think that many of the sites we work with have difficulty putting into place. Not because of lack of, will or desire to be able to offer that, but just the volume might be low, and actually stocking the supplies and having those on hand regularly can be challenging for some sites. Ideally, there's on-site integrated behavioral health services, or you can maintain an updated list of behavioral health referral resources that's annually reviewed and updated for accuracy. The last thing teens need is just to get a list of 40 different therapists in town they can see or try to call and get an appointment, especially if that list is not up to date. You should get yearly trainings to the providers and staff on cultural responsiveness. That includes addressing topics such as sexual orientation, gender identity, or cultural norms specific to the patient population. So if we're working with a practice who serves an Amish population in Southwest Michigan, that's going to be some cultural norms that they need some training with. Or if they're in the UP of Michigan or are taking care of Native populations, they should be familiar with the culture the teens come from. And then we should get routine feedback from the adolescent patients who are there and use that feedback to improve clinic access, quality, and services. All right. So does this do any good? Is this helpful? Well, I would say yes. So we looked at clinics that participated in the Adolescent-Centered Environment Program, and they showed significant improvements. We're going to go through what we looked at following their 1-year implementation, and those improvements were sustained through the following year. So we surveyed some adolescents in the clinics who were seen there, and this was their report is, and this is really thinking about how baseline was thinking about healthcare providers at the clinic. Do they, and you go down the list, ask you about physical and mental health, show respect for what you have to say, explain things so you can understand, and spend enough time with you. The follow-up was at today's visit. Did the provider do this? And then at 1 year, did the provider do this? And so we saw pretty good increases, even though the teens were pretty happy with their group at baseline. We saw significant increases, and those are statistically significant increases for both year end and the 1-year follow-up. We also asked the adolescents a number of other questions. So just about the clinic in general, can they get information to better understand issues affecting my health? That went up pretty dramatically. And I will tell the clinic provider my concerns, even if they don't ask. Teens seem to feel empowered to do that. I'm completely honest, went up a little bit, not as much as the others. The really higher increases were in, I know what health services I can get without my parents knowing or saying it's okay. And I know how to contact my provider or clinic if I have questions or concerns. And then the other area, the reception area and office staff are welcoming, and I'd recommend this clinic. Both also went up. All right. The providers at these clinics tended to improve things, and these are in black and white. This is a little bit harder to see, but the darker, I guess darker black are always or usually. This is using standardized tools, and counsel about risky behaviors went up by provider report. The provider perception that teens will answer didn't go up as much, but it was still statistically significant. Providers did feel their clinic is more welcoming to teens and think the teens know what services they can get without parental consent. And this is their comfort level. Again, did not go up as much. I think doctors sometimes question our own degree of skills dealing with teens. But even though it went up from baseline to 1 year, and then it persisted for 1 year, statistically significantly higher, that they're confident in their ability to connect with adolescent patients. And then office staff also saw an increase in these kind of teen-friendly behaviors. As a whole, staff in our clinic increased their ability to listen to and objectively consider what adolescent patients have to say, accurately discuss confidentiality, provide support for treatment, equal opportunity for all adolescent patients, use positive body language, display a positive attitude about making personal change, avoid using medical jargon, did not persist. I think the staff continues to see medical jargon used. I guess that habit many of us have. And then the staff really engaged in continuous learning to maintain high standards of practice, really went up quite a bit. All right, so that is our approach to improving care, and it shows some persistent effects. And what do teens think about this? What do teens themselves think about dealing with doctors? And they are the experts in their own health. And so we're going to watch one more video before we finish.
You're a doctor. We know you're an expert in medicine, and we know you work hard to be helpful.
We know that you care.
We're teens, and we're experts in being teens, which is why we're talking to you, because we want you to understand that our health means everything to us, and that sometimes going to the doctor can be hard.
Even though we're all different, here are some guidelines you can follow that will help us feel more like listening to you and help us feel like we have a voice in our health.
We want to know our honesty will never be punished and no assumptions will be made. Be straightforward with us. Confidentiality is key.
Let us know how your policy works. Show us where it's posted. Clearly explain what you have to share with our parents or guardians and what we can ask you not to share.
We are each our own person, and we need to know we're getting the full version of what's going on with our health.
It might sound basic, but be human. Start from there to show us you care.
This might be a simple question about our day or a random story about your drive to work. Breaking the ice with us can be that easy.
You don't need to try to be our friend, and you don't need to try to use our slang or make pop culture references to relate.
Just calling us by our preferred name and remembering that what we're interested in can go a long way.
And if you ever run late for an appointment, try to acknowledge our frustration and meet it with your patience. And if we're ever late to our appointment, keep in mind we're not always in control of our circumstances. Your patience with us is really appreciated.
Talk to us like we're adults, but check in with us and make sure we understand the terminology, the causes, and the consequences. Please help us understand our options, but not too many. And if we don't seem in the mood to talk much, please don't push us.
It's not personal. We might be struggling with some sensitive subjects, and sometimes it's just tough being a teen.
So last time I was at the doctor's office, my mother was in the room every time I would answer a question. And I had no idea what I could or could not consent to, and it made me feel like I had no control over what was happening to me or my healthcare or my own body. It would have helped if the doctor had asked my mother to leave, if I had been able to talk to him one-on-one, and if he had some sort of poster or pamphlet or just told me verbally what I was allowed to say, knowing that it would not get back to my parents, and what he would have to tell her.
I've gone to the same doctor my entire life and personally know them, and there have been instances where when they're asking us like questions when we get our physicals, like, do you smoke, do you have sex, and because they personally know us, they just assume that we don't do any of that, and they just immediately are like, oh, you don't have sex or you don't smoke, and just makes us feel like less comfortable to tell them the truth.
When I was younger, I was suspended from school for kind of just like a temper flare, you could say. My mom decided she was going to take me to my doctor, and she treated me as if I were a child who'd had no... You can follow these fundamentals to help treat us with better care.
To help us see how you care, no matter how different we are. Be straightforward.
Be human.
Confidentiality is key.
Check in with us.
Talk to us like adults.
Give us options.
Keep us in the loop.
It's our body, our life.
And I'd really encourage you, if you're interested in this assessment process or some of these resources, you can find us at adolescenthealthinitiative.org. That'll pop you over to a University of Michigan domain. But please check out many of our free materials, and we would love to work with you.